Riz here from careercrawlers.com, a place where you learn how to land jobs. In today's video, I will provide you with 19 nursing interview questions, each one with a high converting sample answer that you can use right now during your nursing interview. Let's get started. Question number 1. Tell me about yourself. First of all, thank you so much for giving me the opportunity to be interviewed here today. From the start, I've always been passionate about wanting to help others, and that's why I decided very early on that I wanted to be in the healthcare industry. I graduated from, here you can mention the name of the college or university you graduated from, with a degree in nursing. I believe my previous experience working as a nurse has provided me with the knowledge and skills I need to excel in this position. I have worked hands-on with a team of nurses caring for patients while conducting assessments on a daily basis. I enjoyed working in a team environment, sharing knowledge and improving our skills collectively. Some other of my major responsibilities were stabilizing incoming patients, communicating with doctors, providing up-to-date information, administering medication, and maintaining patient records. Even though my job was quite intense, working in a fast-paced environment, I loved the challenge because I thrive under pressure. It brings out the best in me since I'm not only able to remain focused, but can manage different responsibilities, stepping in for my team members when they need me most. I'm now looking to continue to grow and excel, therefore looking for a more senior role with greater responsibilities, which is why I am here today. I believe I have a lot to offer, not only through my skill set, but also my values, which I am confident align with those of your organization. As you know, in this line of work, not only do you have to display high levels of integrity and perfection, but you also have to be compassionate. Question number 2. Why do you want to work in this industry? I find it very gratifying and motivating, helping others and providing them care. Becoming a nurse will give me the unique opportunity to help others work towards achieving a healthy state of being. I believe your health is one of the essential factors in enjoying a full life. I've always found it very easy to connect with people throughout my life and build strong relationships with them. Hopefully, as a nurse, I will be able to build influential relationships with my patients to inspire them positively. I'm proud of my ability to work in a team environment, and this has been something I've been doing since high school. Being able to work in a team will not only allow me to learn more on the job, but will also allow me to use the skills I'm most proud of. For example, creating reports, researching, and hopefully managing a team in the future. Finally, this career is extremely rewarding in nature. It can provide stable work opportunities, and the industry itself has enormous mobility for progressive roles. I want to work in an industry that will allow me to grow personally and professionally, and that's why I have chosen the nursing industry. Question number 3. Why should we hire you? As a dedicated and compassionate nurse with a diverse background in healthcare, I am enthusiastic about the opportunity to bring my skills and experiences to your team. My journey in nursing has equipped me with a comprehensive set of skills that I believe are critical for this role. In my previous job roles, I have worked in various healthcare settings, including a busy city hospital and a community health center. This has provided me with a broad perspective on patient care, enabling me to adapt to different environments and patient needs efficiently. My experience in these settings has developed my ability to work under pressure, manage multiple tasks simultaneously, and deliver high-quality care even in challenging situations. I am particularly proud of my ability to establish strong, trust-based relationships with patients. I believe that effective communication and empathy are as important as clinical skills in nursing. In my previous roles, I have consistently received positive feedback from patients and their families for my compassionate approach and my ability to make them feel heard and cared for. I am also committed to continuous learning and professional development. Nursing is an ever-evolving field, and I stay updated with the latest practices and technologies to ensure the best care for my patients. My previous roles have involved mentoring new nurses, which has not only helped me sharpen my own skills but also allowed me to contribute to the growth of others in my profession. Furthermore, I have experience in specific areas, such as geriatric care and emergency nursing, which I believe will be valuable in this role. My ability to quickly assess situations and make informed decisions can be a significant asset to your team. I believe my combination of hands-on experience, commitment to patient care, and continuous professional development make me a strong candidate for this nursing position. I am excited about the opportunity to contribute to your team and support the health and well-being of your patients. Question number 4. Why are you leaving your current position? When responding to the question, why are you leaving your current position in a nursing interview, it's important to be honest yet positive. For example, I am seeking a new opportunity in nursing that aligns more closely with my long-term career goals and provides a new set of challenges and learning opportunities. My current role has been a significant and fulfilling part of my career journey. I have gained valuable experience and skills that I am eager to apply and expand upon in a new environment. In my current position, I have had the opportunity to work in a fast-paced setting, caring for a diverse patient population. This experience has been instrumental in enhancing my clinical skills, communication abilities, and adaptability. I have also had the privilege of working with a fantastic team, contributing to patient care, and learning from some highly skilled and experienced colleagues. After thoughtful consideration, I have decided to seek opportunities that offer a different scope of practice or specialization. My goal is to broaden my experience in areas such as pediatric care or community health nursing, which I am deeply passionate about. This move is a step toward fulfilling my career goal of becoming a well-rounded nurse with expertise in various aspects of nursing care. Additionally, I am looking for a role that offers opportunities for professional development and growth. While I have greatly appreciated the learning experiences in my current role, I believe that transitioning to a new environment will provide fresh perspectives and challenges that are essential for my professional growth. My decision to seek a new position is driven by a desire to expand my nursing expertise, explore new areas in nursing, and continue growing as a healthcare professional. I am enthusiastic about the opportunity to bring my experience, skills, and passion for nursing to a new team and contribute positively to patient care. Now, here's a quick reminder. Don't forget to customize the answer, adding your own skills and experience. This way, it will be a better fit for what the hiring managers are looking for in a candidate. Question number 5. What do you think of your last job or boss? When asked about your thoughts on your last job and your boss in a nursing interview, it's important to keep your response positive and professional. For example, reflecting on my previous job and my relationship with my boss, I am filled with gratitude for the experiences and opportunities I had there. Working in different nursing roles, including in a busy hospital and a community care center, provided me with invaluable experiences that have significantly shaped my professional journey. My last job offered a dynamic and challenging environment where I was able to develop my nursing skills extensively. I had the opportunity to work with a diverse patient population, which enhanced my abilities in patient care, communication, and adaptability. The fast-paced nature of the work taught me how to efficiently manage my time and prioritize tasks, skills that are essential in nursing. Regarding my last boss, I have great respect for their leadership and management style. They fostered a culture of open communication and continuous learning, which I found incredibly supportive and motivating. My boss was approachable and knowledgeable, always willing to share their expertise and provide guidance when needed. They encouraged team collaboration and often sought our input on improving patient care and workflow, which made me feel valued as a team member. My boss was instrumental in my professional development and recognized my potential and provided opportunities for me to take on more responsibilities and engage in professional development activities. This support played a significant role in building my confidence and competence as a nurse. My experience in my last job and the guidance from my boss have been fundamental to my growth as a nursing professional. I am eager to bring the skills, knowledge, and positive experiences I gained there to a new role, continuing to grow and contribute to patient care. Question number 6. What did you not like or like least about your position? When answering a question about what you liked least about your previous nursing position in an interview, it's essential to stay positive and frame your response in a way that shows your professionalism and commitment to growth. In my nursing career, I've had the privilege of working in diverse settings, including a specialized clinic and a general hospital ward. These experiences have been incredibly enriching and instrumental in shaping my skills and perspective as a nurse. While I've enjoyed many aspects of these roles, there were certain challenges that stood out. One aspect I found particularly challenging in my previous position was the high patient-to-nurse ratio. At times, this made it difficult to spend as much time as I would have liked with each patient, providing that individualized care which is so crucial in nursing. I am deeply passionate about delivering quality care and building connections with my patients, so it was sometimes frustrating when external factors limited this aspect of my job. Another challenge was the administrative workload. While I understand the importance of documentation and administrative tasks in ensuring quality patient care, I occasionally felt these responsibilities took time away from direct patient interaction. Balancing clinical duties with paperwork is a common challenge in nursing, and I've always strived to manage it effectively. I believe that facing these challenges has made me a more resilient and adaptable nurse. It has taught me the importance of efficient time management and prioritizing tasks in a fast-paced environment. I have also learned to communicate effectively with my team to ensure that all patient needs are met, even during busy periods. While there were aspects of my previous positions that were challenging, I view them as valuable learning experiences. They have strengthened my skills and prepared me for future roles where I can continue to grow and contribute to providing excellent patient care. Question number 7. Tell me about one of your greatest accomplishments in your previous role. When discussing your greatest accomplishment in a previous nursing role during an interview, it's important to choose an example that showcases your skills, dedication, and impact. One of my greatest accomplishments in my previous nursing role, which involved working in both an intensive care unit and a community health setting, was leading a project to improve patient education and engagement. This initiative holds a special place in my heart because it not only enhanced patient care but also allowed me to merge my clinical skills with my passion for patient advocacy and education. The project began when I noticed a recurring pattern where patients discharged from our unit often had readmissions due to misunderstandings or lack of information about their home care and medication management. Recognizing the importance of patient education in preventing readmissions, I proposed a more structured approach to patient and family education before discharge. With the support of my supervisor and colleagues, I developed a comprehensive patient education program. This involved creating easy-to-understand educational materials, conducting training sessions for nurses on effective communication strategies, and setting up one-on-one education sessions with patients and their families prior to discharge. The aim was to ensure that patients left our care with a clear understanding of their health conditions, medications, and self-care practices. The results of this initiative were exciting and rewarding. Over the next few months, we saw a significant decrease in readmissions from our unit. Patients expressed higher satisfaction with the care received, and my nursing colleagues reported feeling more empowered and effective in their patient education roles. This accomplishment was particularly fulfilling because it had a tangible impact on patient outcomes and overall healthcare quality. It also exemplified my commitment to patient-centered care and continuous improvement in nursing practices. Question number 8. What is your greatest weakness? In a nursing interview, when asked about your greatest weakness, it's essential to approach the question with honesty and self-awareness, while also highlighting your determination to improve. One of my greatest weaknesses is that I tend to be overly critical of my own work. In my previous roles, I often found myself spending extra time reviewing and revising my tasks to ensure they were perfect. While this level of attention to detail can result in high-quality work, I realize that it can also lead to a time management challenge. However, I have been actively working on finding a balance between ensuring quality and meeting deadlines more efficiently. For instance, I've started setting specific time limits for each task and sought feedback from colleagues to gain different perspectives, which has helped me streamline my workflow and become more efficient in my role. As a result, I've been able to maintain high standards while also meeting project deadlines effectively. Question number 9. What is your greatest failure, and what, if anything, did you learn from it? One of my greatest failures occurred in a previous job role where I was tasked with managing a team of individuals to complete a critical project. I underestimated the importance of clear communication and effective leadership, and as a result, the project encountered numerous setbacks and ultimately did not meet its objectives. I realized that I had not provided my team with a clear vision of the project's goals and expectations, which led to confusion and misunderstandings among team members. Additionally, I failed to allocate tasks and responsibilities effectively, resulting in a lack of accountability within the team. This lack of direction and accountability led to missed deadlines and a disorganized work environment. I did not actively seek feedback from team members, which prevented me from identifying and addressing issues in a timely manner. Ultimately, morale within the team suffered, and team members became disengaged from the project. From this failure, I learned several valuable lessons. Firstly, effective communication and leadership are crucial in any role, especially when managing a team. I learned the importance of setting clear expectations, providing regular feedback, and fostering a collaborative work environment. Additionally, I realized the significance of actively seeking input and feedback from team members to continuously improve processes and address issues promptly. I now make sure to apply these lessons in future job roles, and I am now more effective at leading teams and managing projects successfully. This experience taught me that failures can be valuable opportunities for growth and development when we take the time to reflect, learn from our mistakes, and apply those lessons to future endeavors. Question number 10. Why is there a gap in your employment history? Can you explain? After my last job, I decided to take time off to study part-time and pursue my passion for traveling. After graduating from college, I started working right away because I could not afford to travel at that time. However, now that I was able to gain some experience in my field and with a solid financial foundation, I decided to travel. Traveling was one of the best decisions I've made because it broadened my perspective on life. Through traveling, I was able to connect with many people from different walks of life, cultures, and professions. I have become more confident in the way I communicate with others. My ability to communicate more thoroughly is a skill I knew I would be able to utilize in nursing, especially inpatient care, which is all about rapport building. While traveling, I was studying in the most beautiful places ever. The ability to study on my own time gave me a greater appreciation for the material that was covered in the books. Subsequently, it renewed my passion for knowledge and my career choice. Question number 11. In your opinion, what makes a good leader? In my opinion, a good leader possesses a combination of essential qualities and skills that not only inspire and motivate their team but also drive success in their organization. Throughout my previous job roles, I've observed and experienced effective leadership, which has shaped my understanding of what makes a good leader. First and foremost, a good leader leads by example. They set high standards for themselves and demonstrate the work ethic, dedication, and professionalism they expect from their team members. This approach fosters respect and trust within the team. Effective communication is another critical attribute of a good leader. They must be able to convey their vision and goals clearly, ensuring that every team member understands their role and responsibilities. Empathy is a quality that distinguishes exceptional leaders. Understanding the needs and aspirations of team members and showing genuine concern for their well-being creates a supportive and inclusive work environment. It allows leaders to tailor their approach to each individual, which can enhance motivation and job satisfaction. Decision-making is a pivotal skill for leaders. They should be capable of making informed and timely decisions, even in challenging situations. Being accountable for the outcomes, both positive and negative, of their decisions is also crucial. Leaders should be adaptable and willing to learn from their mistakes. I believe a good leader is someone who leads by example, communicates effectively, makes sound decisions, and delegates wisely. These qualities will inspire their team and drive productivity, ultimately contributing to the overall success of the organization. Question number 12. How do you motivate others? Or how do you bring out the best in your staff or team? Motivating others and bringing out the best in a staff or team is a crucial aspect of effective leadership, and I've learned several strategies through my previous job roles that I believe contribute to this. First, it's essential to set clear expectations and goals. When team members understand what is expected of them and have well-defined objectives, they are more likely to be motivated to achieve those goals. During my time in previous roles, I made it a priority to communicate these expectations clearly and provide regular updates on progress. Recognition and appreciation are powerful motivators. I've found that acknowledging and praising the efforts and achievements of team members can boost morale and motivation. Simple acts of appreciation, such as verbal recognition or small rewards, can go a long way in showing that their contributions are valued. Effective communication plays a significant role. I make an effort to be accessible to my team, actively listening to their ideas, concerns, and feedback. Creating an open and transparent communication channel encourages team members to share their thoughts and feel heard, which can lead to improved motivation. Empowering team members to take ownership of their work is another strategy. When individuals feel a sense of autonomy and responsibility for their tasks, they tend to be more motivated to excel. In my previous roles, I delegated responsibilities while providing guidance and support, allowing team members to develop their skills and take pride in their work. I believe that leading by example is crucial. Demonstrating a strong work ethic, dedication, and a positive attitude can inspire others to follow suit. In my previous positions, I made an effort to be a role model, showcasing the behaviors and qualities I expected from my team. Question number 13. Being a nurse can be overwhelming. What do you think is the hardest part about being a nurse? I believe the hardest part of being a nurse is having to deal with the loss of life and the impact it leaves on immediate family. Loss of life is not only heartbreaking for the family members but also for us nurses, since we have built up relationships with our patients. A patient is brought to us to seek help and recover. I feel as a nurse, I am personally responsible for their well-being. When a patient's illness is so aggressive and you are not able to help any further, you still feel burdened with the fact that you let them down. These situations are very sensitive and can impact us nurses emotionally. Question number 14. How well do you thrive in a fast-paced environment? I thrive in fast-paced environments and have successfully navigated such settings in my previous job roles. These experiences have allowed me to develop the skills and attributes necessary to excel in high-pressure situations. One of the key strengths I bring to a fast-paced environment is my ability to adapt quickly. I've learned to remain calm and composed, even when faced with tight deadlines or rapidly changing circumstances. This adaptability has enabled me to make swift decisions and take immediate action to address challenges as they arise. Effective time management is another skill I've developed in fast-paced roles. I prioritize tasks, set clear objectives, and create efficient workflows to ensure that I and my team can meet tight deadlines without compromising on the quality of our work. I've also become adept at multitasking, which is often essential in fast-paced settings where numerous tasks and projects demand simultaneous attention. In my previous roles, I've found that communication is paramount in fast-paced environments. I ensure that information flows smoothly among team members and departments to prevent bottlenecks and maintain alignment on goals. This proactive approach to communication helps minimize misunderstandings and keeps everyone on the same page. I embrace challenges and see them as opportunities for growth. I enjoy the energy and excitement that come with fast-paced work, and I'm driven by the sense of accomplishment that comes from overcoming obstacles and meeting tight deadlines. I am confident that my experience in my previous roles has equipped me with the skills, mindset, and adaptability needed to thrive in fast-paced environments. I view these environments as a chance to demonstrate my abilities, drive results, and contribute positively to the success of the organization. Question number 15. What would you say are the biggest challenges nurses face? I believe nurses face several significant challenges in their roles, which I've observed during my previous job roles and interactions with healthcare professionals. For example, nurses encounter heavy workloads and understaffing. In many healthcare settings, nurses are often required to care for a large number of patients, leading to high levels of stress and burnout. This can negatively impact the quality of care provided and the overall well-being of nurses. Nursing can be emotionally and physically demanding. Nurses frequently deal with patients who are critically ill or in pain, which can be emotionally taxing. Additionally, they may need to lift and move patients, increasing the risk of physical injuries. I also think that nurses often work long hours and irregular shifts, including the nighttime, weekends, and holidays. This can disrupt their sleep patterns and personal lives, contributing to fatigue and work-life challenges. We shouldn't forget that healthcare is an evolving field, and nurses must stay updated with the latest medical advancements and technologies. Continuous learning and professional development are essential but can be challenging to balance with their demanding work schedules. Finally, nurses may encounter ethical dilemmas, such as balancing patient autonomy with the need for medical interventions or navigating end-of-life decisions. These situations can be emotionally challenging and require careful consideration. Question number 16. How do you handle mistakes as a nurse? Handling mistakes as a nurse is a crucial aspect of providing safe and effective patient care. Throughout my various nursing roles, I've learned the importance of a systematic and empathetic approach to addressing errors. First, when I make a mistake, I prioritize patient safety above all else. If the mistake has the potential to harm the patient, I immediately assess the situation and take any necessary actions to mitigate harm. This may involve notifying a senior nurse or physician, documenting the error accurately, and implementing corrective measures as directed. I strongly believe that communication is key in the aftermath of a mistake. I ensure that I inform my supervisor or charge nurse about the error promptly and honestly. It's essential to be upfront and take responsibility for any mistakes made. Open and honest communication helps in finding solutions and preventing similar errors in the future. I also use mistakes as opportunities for learning and improvement. I reflect on what went wrong, why it happened, and what steps can be taken to prevent a recurrence. This may involve seeking additional training, reviewing protocols, or implementing new safety measures. Sharing the lessons learned with colleagues can contribute to a culture of continuous improvement within the healthcare team. Emotionally, it can be challenging to cope with mistakes, but self-compassion is crucial. I remind myself that every nurse makes mistakes at some point, and it's part of the learning process. Handling mistakes as a nurse involves prioritizing patient safety, transparent communication, learning from errors, and practicing self-compassion. These approaches have helped me navigate challenging situations and ensure the best possible care for my patients in my previous nursing roles. Question number 17. Describe your ability to stay organized when performing your nursing duties and responsibilities. I am a strong believer that staying organized while performing nursing duties and responsibilities is of utmost importance to ensure the safety and well-being of patients. In my previous nursing roles, I have developed my organizational skills to deliver high-quality care effectively. One key aspect of my organizational ability is time management. I prioritize tasks based on their urgency and importance, ensuring that critical patient care needs are addressed promptly. I create daily schedules or to-do lists to help me stay on track and avoid overlooking essential responsibilities. Documentation is another critical component of nursing, and I maintain meticulous records of patient information, medications administered, vital signs, and other relevant data. Keeping accurate and up-to-date records is essential for continuity of care and effective communication among the healthcare team. I also maintain an organized workspace, ensuring that medical supplies and equipment are readily accessible and well organized. This facilitates efficiency during patient care and emergency situations, reducing the risk of errors. Effective communication is vital in healthcare, and I make it a point to communicate clearly and efficiently with patients, their families, and colleagues. This includes providing patients with understandable instructions, reporting changes in patient conditions promptly, and collaborating effectively with other healthcare professionals. In emergency situations, my ability to remain organized under pressure is crucial. I follow established protocols and guidelines, ensuring that critical interventions are performed swiftly and accurately. I also maintain composure and focus to provide the best possible care to patients during these challenging moments. Staying organized while performing nursing duties and responsibilities is essential for delivering safe and effective patient care. My experience in previous nursing roles has equipped me with strong organizational skills so I can provide the highest standard of care to patients in a healthcare setting. Question number 18. Describe a time you went above and beyond as a nurse. In one of my previous roles as a nurse, there was a particularly memorable instance when I went above and beyond to provide exceptional care to a patient. This patient was an elderly individual who had been admitted to the hospital for a severe respiratory illness. They were scared, anxious, and struggling to breathe, which made their condition even more distressing. Recognizing the urgency of the situation, I made it my priority to provide not only the necessary medical care but also emotional support. I stayed by the patient's side throughout the night, continuously monitoring their vital signs and administering medications as prescribed. I also took the time to reassure them, offering words of comfort and encouragement. I noticed that the patient's room was quite cold, which was making them uncomfortable. To address this, I took the initiative to find extra blankets and adjust the room temperature to ensure their comfort. I also coordinated with the respiratory therapist to optimize the patient's oxygen therapy. Throughout the night, I kept the patient's family informed about their condition, providing updates and answering their questions to alleviate their anxiety. By going above and beyond in this situation, I aim to not only address the patient's medical needs but also provide compassionate and attentive care. It was a challenging night, but knowing that I could make a positive difference in the patient's experience and contribute to their recovery made it all worthwhile. Now, here's a quick reminder. Don't forget to customize the answer, adding your own skills and experience. This way, it will be a better fit for what the hiring managers are looking for in a candidate. And question number 19, what is your salary expectation? This is sometimes a tricky question to answer. Hence, you need to thread carefully. If you have applied for a job through an agency, then it is wise to let the agencies carry out the salary negotiations on your behalf. Hopefully, the agencies would have relayed to the recruiter your salary expectations in advance, or alternatively, you can suggest to the employer that they can speak to your agency concerning this matter. However, in instances where this is not the case or is not possible, it is fair for you to state that you would expect to be paid in line with what the industry standard is for the level of experience you have to offer to the role. Hence, do your research beforehand so that if you need to give an average salary range, you can put this forward. If you want to learn more on how to land jobs and reach your career goals, don't forget to hit that subscribe and bell notification button to get new videos every single week. Also, don't forget to hit that like button because that motivates me to keep doing what I do. Stay safe, keep smiling, and good luck.